Good evening, everybody. We're going to go ahead and get started with the CMH Community Mental Health Board. So I'm going to call the meeting to order, and we're going to start with the Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The mics are on. Should I go around and turn them off?
Can I have somebody that will read the mission?
Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. And do we have a motion to adopt the agenda?
So moved.
Support.
Thank you. We'll adopt the agenda. The next on the agenda is hearing of the public. Is there anybody from the public that would like to speak? Anyone from the public? Okay. We're going to go ahead and move on to item number 5, the minutes. Do we have a motion and a second for the minutes? Request final approval, minutes from the regular meeting of the CMH full board held on Wednesday, July 26th.
So moved. Support.
Thank you. Moving on to item 6, approval of standing committee meeting minutes and recommendations. 6A, there are no minutes for the approval from the August 9th CMH budget meeting that we did not hold. Moving on to item 7, request to approve. 7A, the MOU for Oakland Community Health Network. This has been approved by legal. And do we have a motion? Support. Thank you. And Tracy, do you have anything to add to this?
Sure. So this is a relationship that we're establishing with the Oakland County version of us. The purpose of this relationship is they actually have 2 registered nurses that will be providing our medication training. In order for you to provide services in some of the homes or some of the services, you do have to have medication training and also pass an assessment. So they're assisting with us, and it's just a cost savings manner for us, both organizations, in order to maximize these services.
Any questions for Tracy? All approved?
Aye.
Aye.
Any against? Okay, motion passes. 7B, execute agreement that has also been approved by legal. Dave?
Good evening. Nexecute, we have an agreement currently in place. Chris Elias is the principal, and he works with us through our strategic planning process. He facilitates our quarterly and biannual and annual meetings. What we've noted in our workforce development efforts during this period of time is, it's kind of the way of community mental health is if you've been in a position for a while and there's an opening, you get promoted up into as a supervisor. But they're really not supported as fully as they should be or could be at times in how to act in that role. So Chris has an additional program that will help our workforce development efforts, and it's intended for everybody. We will identify a cohort of individuals who we see as future leaders, and they'll go work through Chris's program, which is structured, and we hope the outcomes and the benefit would be very positive. I have worked with Chris in this program before. Adam Genovi, our former chief operating officer, had gone through it as an example and things like that. So again, we're looking to kind of spend some of the money while we have it on things that will pay off in the future. I've mentioned that before. And workforce development, I think, is a really good use of those dollars.
Thank you. Any, Nick?
I was just gonna say, I think this is an excellent use because it's one time only. My only concern is that you make sure we screen to try to make sure we put people in the program that are gonna stick around. We've had a lot of turnover recently for some good reasons, for various reasons. This may help mitigate against that happening, but it also could mean we're training people to go to work
Yeah.
for somebody else. So
I
we'll have
think
to
that,
rely
yeah.
on you to do that screening.
We hope that doesn't happen, of course,
Right.
but yeah, we are looking at people who, like I said, we see as future leaders
Yeah.
within our organization, and showing commitment to our organization would be a factor as we.
And just because I like to deal with my ignorance here, what is the Colby A indexes?
I'm not going to be able to explain that as well as Chris does. But we just had a meeting with Chris and we're able to review it. It's an assessment that all of the leadership team has taken now. And it gives an overall picture of how you prefer to function, in a work environment. So whenever you get your results, it says, congratulations, you've scored perfectly on your Colby assessment, because no matter how it comes out, it's all perfect. So there is it doesn't compare us against each other, and no one person is any better. But it shows us how different members of our leadership team prefer to interact. Some people are, Chris's example was a risk taker. He's a 9, and he would jump off of a cliff without checking for rocks underneath or for how deep the water was. He's all in. Some people are more risk adverse. So when you're looking at team building and project planning, and working with your colleagues, that type of assessment comes in handy. With our 90-day projects and our 12-month initiatives, if we have somebody who is not great on follow-through, we're going to need to set some shorter goals and timeframes and check-ins and things like that. So as part of this leadership development, they will go through that process, learn a little bit about themselves, learn about their coworkers, and how to build a good team.
To approve on this one, like I make a motion to approve us talking about this. I think we forgot, but I was gonna move to approve on it anyways.
And support.
Any other discussion? Okay. All in favor?
Aye.
Any opposed? Motion passes. Item 7C, Bolden AFC LLC Home. Is there a motion to approve? Support?
Mark.
Thank you. Tracy?
This is for one particular person served. You'll notice it is out of our geographic area. It is the preference of the person, and they've actually been requested to go there, and they've been in that geographic area for a period of time. So just to explain a little bit of the odyssey of this particular one.
Any discussion? Okay. All in favor?
Aye.
Any opposed? Motion carries. Item 7D, MCCMH is requesting approval to contract with Avity Consulting Group LLC for lobbying.
Pronunciation.
And do we have a motion on that?
Support.
Donna?
Yeah, I'd like to make a motion to move this item to policy and legislation. And if there's support, I'll speak to it.
Do we have a second on that, to move it to legislation and policy?
Which item?
Frank
The Accavetti.
Gacavetti, lobbying.
7D, the lobbyist
Yeah,
one.
I'll support.
You'll second it? Any discussion on this?
Madam Chair,
Yes.
is there any, Dave, is there any harm in postponing this and going to,
No, the request, as listed here, was simply for us to move ahead in the
Okay.
contracting process with Frank. So having the policy and legislative committee involved, I think will help in that process.
I do have a follow-up question. My only question regarding the contract, I read through it. Is there a termination provision, if we could terminate at any time, and what was that? I couldn't find it.
That'll be negotiated still, so we can,
Okay,
we'll come back with a,
with a
with a proposed
Okay.
contract.
Yeah, if I can, to that point, I read the backup material the same way Ryan did, as a contract that we were being asked to approve. Our discussion earlier was, no, that's not a contract, that's his proposal, and that we would be negotiating from here. I have some concerns about whether, I've got a lot of concerns, and I think the committee can deal with that and
In
work with
committee.
it. Yeah, and then bring something back to full board.
Yeah, that's,
Okay.
Okay.
I have a question.
Just so I can finish speaking on the.
I'm sorry, Donna.
Yeah, there are a lot of questions and concerns related to this issue, and that's why I thought having it go to the committee would probably be the best place where the committee can try to answer and weed out all of the concerns and questions that we're asking right now. And so that's why I thought the best place would be within the legislative committee to answer the questions and try to weed out a lot of the concerns. Thank you.
Thank you. Linda, did you have something?
I vaguely recall that in the last year, we used a lobbyist for something. That was the county's lobbyist that you were with?
County's lobbyist.
The what?
We use the
The
county's.
county's lobbyist. So we have never had a
I don't
contract.
even recall using the county's
Yeah,
lobby.
we did.
Yeah.
Phil, of course, is a legislative employee. I used to be a lobbyist. We did a lot of consultation back and forth, and then I consulted with Gary Owen, who's the county's lobbyist, and he was helpful in a number of areas.
So we never have had a contract for a lobbyist before. And this was, one name, this is a sole source bid. It's a,
No, it went through the RFP, and Frank was selected.
Any other discussions on this? So we do have a motion.
We have
to
two
bring this-
motions on
We have
this.
two motions. The first motion, we would move into the second one that is going to end up going to legislation and policy. So do we vote on the first one? I'm asking you guys.
I think the motion pending is.
We got a
to
motion
refer-
pending.
The motion pending is to refer to the committee.
yeah. Brought with them.
Or you can withdraw.
Withdraw my original
Thank you.
second,
I second, so I'll
second to that.
Okay.
agree
so
with that.
We have a motion to withdraw the first motion. We have a motion to move it over to legislation and policy committee.
I will second Donna's motion to move the.
I think Nick
Nick
seconded
already
it
did.
already.
Ah, I will third.
Just in case.
I'll defer to Ryan.
I'll defer to Nick.
Who can keep up on these minutes?
All in favor?
Aye.
Any opposed? Motion approved to move it over to legislation and policy. 7F, approval of event promotional materials for integrated healthcare event. Do we have a motion?
I think we skipped one.
I forgot E.
Oh, I'm sorry. I forgot E. Leslie, take a seat for a moment. 7E, approval of service to enhance potential STEP capacity building grant, approval by legal.
That's
Do
me.
we have a motion on that one? See, you're messing me up.
So moved.
Support. Thank you. Dave, what would you like to discuss?
So moved. I second that. I do not have the packet here in front of me, so I'm going to be going by memory. STEP submitted a proposal under our capacity building grant opportunities. One was to assist us in growing and expanding Project Search within Macomb County. Project Search is a international model now of school-to-work transition for students in special education. It has really good outcomes. I worked that model for a number of years in Wayne County. We had an 86% employment rate for the graduates, compared to nationally, the employment rates tend to be about 14%. It's a partnership between the school system, and we've talked to the intermediate school district. They're on board. Michigan Rehabilitation Services is on board. Their vocational counselors would help support the participants in Project Search as that goes forward. And then we would be contributing, doing a interagency cash transfer arrangement with MRS, which is a very neat thing that turns $1 into $3 pretty much. And we would help support those classroom activities going forward. So to get that up and running, there was some staff involved and things like that. The other is our peer model. Again, the use of peers has been proven to be very effective. And with the staff shortages we're seeing, it just makes a whole lot of sense to expand our use of peers. Identifying people to be peers is difficult sometimes, so you'll have an opportunity come up, and then everybody runs around and they go through the case managers and they're like, ask people on your caseload if they would like to be a peer, and they're like, what's a peer? Which makes sense. This model would actually nurture, cultivate, and produce peers kind of on an ongoing basis, and then support them throughout that entire process. So even after they became certified at the state level, they could come back, be part of the ongoing training process, or they could choose to specialize in areas like housing, healthy living, mobility, transportation issues, employment, everything like that. So we've sketched out the model, and it just needs some seed money to help that grow as well. And I think I covered, yep, good. I'm getting that.
And you're getting a nod from Tracy. Any questions on this or discussion? All in favor?
Aye.
All opposed? Okay. Now we'll go to 7F. And we do have a motion to amend this item due to an increase in the funding of it. And what this item is approval for the event promotional materials for the integrated healthcare event.
So moved.
Support. Leslie?
Yes, so thank you, everyone. So we are hosting our first, and hopefully first of many to come, integrated healthcare fair for the public at the MISD in collaboration with the MISD and other Macomb County departments, including the Macomb County Health Department. And as part of that, which is covered under our integrated healthcare grant funds, we allocated approximately $40,000 for zero suicide and this fair. And we have actually been able to meet that. We are going to be handing out 500 books that are very comprehensive and review a variety of physical and mental health conditions that are common in our population. And it gives kind of information about the condition, tips for talking to your healthcare provider, as well as for mental health, coping mechanisms, for physical health such as diabetes, just helpful hints on like what to look for in foods and things of that nature to help people better understand in the privacy of their own homes what maybe they're struggling with or things that maybe their family's struggling with. So those will be 500 books that will be handed out freely to the public. We are also going to be purchasing 750 shirts, t-shirts with the the logo for the fair, which is the, and I can show you, I have a box of flyers for Selena that says the Integrated Healthcare Wellness Fair, and then on the back has all 33 logo sponsors of our sponsors in full color. And it is a very nice looking shirt. And that will be handed out again to all of our vendors as well as the public, first come, first serve. We didn't really know how many to anticipate, so we figured we'd start with about 750 in various sizes, from a size small all the way up to a size 4X, to meet the needs of pretty much anybody that might be coming, as well as 2,500 drawstring bags that have water bottle holders. We've purchased them in the past. They were a huge hit. They've gone at every event we've had. They have our branding on them and our 1-800 number. And then banners that are 10 feet by 3 feet, not to exceed 2,000, as you saw, for posting up around the community to draw more of the public to the event, where we will have a plethora of resources, educational materials, and then, of course, our Macomb County Community Mental Health representatives to be there to support this event and the public.
Any questions for Leslie about this event? Okay. All in favor?
Aye.
Any
Thank you.
opposed?
Thank you.
Did we cover the dollar amount?
Oh, yes, please let me. It's $32,727.20 in total for all of those things.
Did I hear 40,000 before, something was, 40, was it 40,000 books?
That we allocated for it.
I'm sorry, no, $32,000, 40,000 books, got it.
Yes,
Okay, thank you.
yes.
Nick, did you have a question?
Yeah, the provision, the additional dollars came in which of the categories?
So initially, the book, the line item of the books was not initial, it was missed in the initial total. And then the T-shirts, we anticipated would be approximately 9,000 for the full color logo. We didn't have the finalized proof yet because they had to go to a separate vendor to get that full color request met. And so it took a little bit longer. But we had anticipated, and they had anticipated in collaboration with us, that it would be around $9,000, which is what we were originally looking at, but it actually turned out to be about $11,000. It's about $14 per shirt, because of the number of logos and all of the coloring that's going into it, because there's 33 sponsors in total, including us, all of us.
So, Madam Chair, I think we just approved 30,000, because I didn't hear unless the amendment was offered. Was that, you could ask the maker of the motion if
We did
they
do,
were moving the
when
larger
when
amount.
I brought it up, a motion to amend due to the dollar amount.
Right.
Okay.
My apologies.
Any other conversation, discussion? Okay. Motion passed.
Thank you.
Thank you.
Thank you.
Item 7G, amendment to COVID-19 comprehensive services for behavioral health. It's been approved by legal. Do we have a motion?
Motion.
Support.
Didn't mean to sound like a question.
Dave?
Hesitant support. This is amendment number 2 to the, it's one of the EGRAM contracts for COVID-19 comprehensive services. There was no dollar amount, budget amount change or anything else. The 2 subcategories are CCBHC non-Medicaid support and then enhanced utilization of health information technology. And it's under the those 2 categories that they made some wording changes that we've incorporated.
Any questions for Dave? Any discussion? Okay. All in favor?
Aye.
Any opposed? Motion carries. Item 7H, MISD contracted services. This has been approved by legal.
Support.
Who's supported?
Me. Oh, who supported? I support too.
Dave again.
Okay, who is this, Tracy or Dave?
It's kind of under capacity building. The working with children in foster care is a priority at the state level. We're meeting on a regular basis with Michigan Department of Health and Human Services. One of the evidence-based practices for working with children with trauma is the multisystemic therapy, or MST. I did talk to Dr. Ward, our Chief Clinical Officer, previously on this topic. She was in support, but we have staffing concerns, with being able to find staff that there's a training and certification that goes through the state level in order to be able to provide MST.
Dave, and I apologize for interrupting. I think we've got the motions mixed, if that makes sense. That's Lakeview.
This is the MISD one.
Yeah, I just want to make sure we're,
This is the
Approve the
COVID-19.
contract, Right?
Oh, MISD contracted service.
Correct.
No, this is the COVID-19 that we're on right now.
No, we
just
we
approved
passed
it.
that one.
Oh, sorry.
ISD.
see, Sandy's gone once, and you guys get
So
all
So
kind of.
explain the next one, Dave.
That's
For
why I
the
asked if
record,
it's
we
Dave
all
or
miss
Tracy.
Sandy. So this is H, the
Help
MISD.
Sandy
Right.
watching
Yes, this is
this.
H.
Which
but
is
that's
Tracy.
why I asked if it's Tracy or Dave.
This is Tracy.
This one's much easier than what Dave is going to explain in a little bit more
Yeah, I'm
detail.
jumping in.
This is
You can be quiet, because you're messing me up now.
This is an agreement that we've had in the past. It's at the new year starting for the school year. It's for a 9-month period. We have 3 licensed therapists that are our employees that are stationed in an elementary school, a middle school, and a high school to provide direct services. Their mission is to provide the services on site, but their mission is also, when they're not already connected with CMH services, to do so. So they basically pay our staff, the wages of our staff, and any overhead associated with them to have those 3 team members there.
This is what I started doing when I was hired at CMH. I worked at Neil Reed and Rockwell, and this is such a great service. And I'm so happy to see this back because it makes such a wonderful difference in the kids' lives. And I am so in support of this because they don't get services without this. And they look so forward to seeing a therapist. And we would even bring parents in who had never, ever had services before. So I think this is such a wonderful thing. Thank you so much for bringing this back. I know fiscally we weren't able to do it for many years, but these kids really, really, really need services, and they would never get them otherwise. So I think this is such a wonderful program, and I'm so glad to see it back.
Thank you, Donna.
Thank you.
Any other comments or discussion on this? Okay. All in favor?
Aye.
All opposed? Thank you. Motion carries. 7I, Dave. Approval of Lakeview Consultants LLC agreement not to exceed $34,500 approved by legal. Do we have a motion?
Support.
Thank you. Dave?
So as you may have,
Deja vu?
as you may have heard,
Could you start from the beginning, please?
nope. So what we're looking to do is get a little creative here and have this consultant help us write the RFP, issue the RFP, go through the RFP meeting on this process and help guide us through, because it is a very specific, specialized service. If we get applicants and if one is selected, then it would move into phase 2, and the consultant would help us get that provider up and running within our system and help us integrate that service within our current continuum of care. So it's kind of a missing piece. It's highly specialized. Not sure if there's people out there who, have the capacity and the ability to help us out here in Macomb County, but we definitely are interested in finding out.
Nick?
This is sorely needed, obviously, to work closely with the juvenile detention area. Everybody knows that we don't have to comment on it. The miscellaneous to be determined, is this, I get nervous when I see a billable entity that says
That's
TBD.
why I kind of put the not to exceed.
Oh, okay, so the not to exceed is to the total, but the total comes the same as the not to exceed without the TBD. But we may not be doing all of these things.
Yeah,
Okay.
that was the point I tried to make in the board action request, that if we don't get applicants, there's no need to move forward. That would,
You-
the agreement would cease at that point.
And again, because we run into the legal counsel that indicated that the board and the CEO are personally liable if these contracts aren't co-signed by the county exec's office. I don't see that on the signature page. Is that just
The
missing?
approval comes first, and then the signatures go through.
I know, but on the signature page, there's only place for the agency and
Oh,
there's
that'll be,
nothing on there.
yes,
but
I'm
the
sorry, that'll be-
intent is to have.
yes, that'll be modified.
Yeah, okay, fine. No problem.
Linda?
Not about this contract, this is a great idea. Hopefully it produces what we need. But I just thought there was a threshold under 35,000 that you didn't have to. Oh, there's no
50,000. No, it's currently, no, it's lower than that currently, so we are.
lower than 35. Wow, thanks.
Any other questions or discussions? All in favor?
Aye.
Any opposed? Motion carries. 7J, approval of funding for Cleve Incorporated not to exceed 50,000 as a capacity building grant. Do we have a motion?
So moved.
Support?
Tracy?
Either one.
No, I have Tracy on here.
Oh, Tracy,
The
want
boss,
to do this one?
he can do it. No, he's more than capable.
This one came to us kind of late in the game, but Cleve Incorporated runs, I believe there's two duplexes, so there's 4 unlicensed supported housing sites that have been supporting our folks for a number of years with really good positive results. Because it's the Section 8 housing and stuff, and there's really no money available to them to help with the upkeep. So they submitted a request, and TJ was kind enough to go out, and he went through there with them, and he checked some things off of that list. A lot of it is outdoor. They have a number of large overgrown trees, which, with today's weather creates kind of a hazard. And then there's some flooring rehab and things like that. So it's physical plant and some exterior things around the houses. So it went through our finance meeting, and we do have general fund available. It'll help, make these houses available, these living situations available for our folks longer term, and definitely help out the individuals who are currently living there. So it's a little creative work, but we do have the funding flexibility right now to help support this kind of project. So.
Any questions for Dave? Any discussion? No? Okay. All in favor?
Aye.
Any opposed? Motion carries. 7K, residential lease A, approved by legal. Tracy?
So moved.
Thank
Oh,
you.
sorry.
Support.
You'll notice that this is a short-term, one-year lease. We're doing this because and not to go into too much depth, but when you have a group home, you have a licensure that's associated with the physical location and the provider that's in that home. We are in a situation where we need that home to stay open for the next year while that provider works on moving to a new home and working on a new licensure. Licensure can take, on average, about 6 months. So you'll notice that this is an increase. We are noticing a pattern of increase. I'm sure that would be obvious for the residential market these days is going up. But just know that the intent of this particular one is purposely done for 1 year because we don't have the intentions of after that year to continue it. It's kind of a stopgap. We greatly appreciate this landlord partnering with us to not create a situation where these individuals have to move.
Any questions? Okay. All in favor?
Aye.
Any opposed? Motion carries. Item 8, receive and file. We don't have anything. Item 9, resolutions. We don't have any tonight. Item 10, voucher listings, requesting final approval for payment of the vouchers.
So moved?
Any questions regarding them? Okay. All in favor?
Aye.
Any opposed? Motion carries. Item 11, management report, the CFO report.
Good evening. Sorry, I jumped the gun a little bit there when I stood up, so I didn't mean to confuse.
That's
the,
okay, I'm all over the place tonight. Whispering in my ear.
Everyone should have a printed copy of our report. I'm going to start with some of the issues aren't necessarily listed in the report, but give an update on those things. We've had our ongoing disputes with the state, so give our updates as it pertains to that. The My Health Link State inpatient issue, there's no update since the last meeting. The $19 for the methadone rate, there is no update since the last meeting. And the ISF issue, also no update since the last meeting. So we continue to wait for responses on those items. I will say with the $19 issue, originally we thought that wasn't in the state's fiscal 24 budget. It appears to be in there. However, that doesn't change the opinion on this subject. So I think last time I reported that we didn't note it in there, but it did make it in. So I just wanted to clarify that for the board as well. Another thing that was sent out, I think electronically, was the ISF analysis. So everyone should have that. Just wanted to speak to what that is and how it ties into our discussion in the ISF dispute with the state. So that's a report that we obtained for our fiscal 22 year. It's required. It's something that's required under GASB statement number 10. GASB being the Governmental Accounting Standards Board. And that allows us to support the dollar for our risk reserve and also support our position on this issue. So you can see the ending amount that we have in 22 ties to that that report that they have there, so that this board approved us consulting with the actuaries. They prepared this report independently, and it supports that balance. So we will continue to use this going forward. We have to redo it biannually, I believe. So we can continue to use it for fiscal 23 and expect to put another $6 million or so into the ISF based on that. So obviously we're reaching the end of 23 and going into reporting season, so we'll keep the group updated on that. Is there any questions on that report? I know it might have been recently delivered, so obviously if you have something as you read through it, feel free to email me, or but I'll field any questions you have now. Okay.
Thank you.
Moving on to the next thing I have. Last time I spoke in July, we were talking about having some revenue estimates and things potentially by August 15th. That did not occur. We literally just got off the phone with the state at 5 o'clock today about rates. We do not have final rates, don't anticipate to have final rates for a couple weeks. We have what I'll call tentative rates that appear to be, at least in the States, what they said is significantly correct, I guess, if we can use that term. So that is what we are going to use. We have those appendixes. We're gonna build the budget based on that and expect that to have that before this group in September. I think that's the best information we're gonna have right now. And, obviously trying to get this in before the end of our fiscal year to be going into the next fiscal year with a budget. We need to have something, so that is tentatively our plan. A couple highlights from that meeting: there is a 85 cents an hour plus a 12% admin load onto that 85 cents. That's for DCW. That is legislatively approved at the state level, and they're building those into our rates, so that'll help in the community with the direct care workers. And then in September, we're gonna have a small increase for our fiscal '23 revenue based on the anticipated drop-off of eligibles. So the state is still waiting they have 1 month's worth of impact for the August payments of the eligibles decrease. It's part of the reason they're waiting to certify the rates, is they wanna get another month of data to do so. Any questions on revenue or rates?
Anna?
I was wondering if you were pleased with the tentative rates from the state.
We didn't even know that we had the Excel sheet until we got on the call and they had attached it to the meeting invite. I have not had a chance to even dive in, and we have a fairly complicated modeling spreadsheet, so we'd be running that through the end of this week and into early next week. We do have a meeting with the county finance to go over our budget on Wednesday, the 30th. So looking to have our budget as final as we can have it at that point based on that information. So we do need some time to work
Maybe
through.
you can tell us at the next meeting.
Yeah, oh yeah, absolutely. Yeah, I think even looking at some worst case scenarios, I think it should be fine, generally speaking. I think we have such a surplus in Medicaid and Healthy Michigan that there's a decent amount of buffer there to soak up any decreases. So that's my tentative thought and feeling that I have on that. So I don't think it's gonna be a major decrease or a crisis situation or anything like that.
Thank
So,
you.
yep. And then the last thing I had, I touched on budget. We'll bring that next month. I'll start diving into the standard financial packet here. Page 2. Nothing really jumping off the page there. We continue to have, these numbers are through June, so there's really no change to speak of in revenue or eligibles. We are still evaluating. We should be getting a payment file tomorrow for Medicaid and Healthy Michigan, and that'll shed some light on what it looked like for August. So still some unknowns out there, even at this point in the summer.
Can I ask a question on this point, or you want me to wait?
Go ahead.
Could you just briefly explain what you're saying when you say the Medicaid drop-offs, of the eligibles, and any effort to mitigate that? Because it's not just our budget, and we may have money to buffer it, but it's people not eligible for services.
Right. So yeah, when I say Medicaid drop-off, that's it should be Medicaid redetermination is probably the proper term, where as people come up monthly throughout the year, they come up for redetermination on their Medicaid. There are a large number of individuals that the state is able to automatically renew because of their situation. There's other people that have to fill out paperwork and submit that. So there could be good reasons for people losing Medicaid. The ones that we're trying to mitigate or eliminate are those that, we do have a Medicaid redetermination report that we can run, and we're actively line by line, if they've touched our system at least, why is this person dropping off? Can we get them re-enrolled? Not only for budget purposes, like you said, but to stay in service, and that's important as well. So to the extent that we can control it, I think we're running reports and trying to do so. Obviously, people that aren't in the system, we can't do much to control that, and relying on the state's marketing efforts and that kind of stuff to get that done, so. Is that,
Yep. Thanks.
okay,
Nick, did you want to ask your question?
Yeah, I just wanted to make one comment on the rate-making process, the number of years where we were asked to sign contracts and didn't know what the rates were for 3 or 4 months into the year. Even tentative rates is an improvement over that, although I think we need to continue to harp with the department that they want us to sign a contract, we need to know what the rates are going in. And that's just a comment, you don't have to, I know you're doing that, so.
yeah, I think that the entire state is, everybody's trying to plan for their budgets. We're actually in a, I want to say a better position, but there are regions where they have affiliates within them. So then those entities are trying to plan for their budgets, so.
But this is, the department's getting a little better, finally, because, I mean, there were many years where where our contracts came in, we had no idea what the rates were gonna be.
I think so, and I do think that they are trying to do the best they can in a very uncertain time.
Yeah.
And not trying to jump to something that part of me prefers it, instead of trying to do something one way and then amend it 3 or 4 months later, and then we have the changing of the rates again and stuff. So there's some, it's a double-edged sword, right? So we will do our best estimate, and if we have to come back with a budget amendment after that, we will do so. Anything else on this page? Page number 3, I don't think there's anything significant compared to prior meetings. Cash and liabilities continue to be high as we owe the state for previous years. We did settle 18-19 and expect to have that recouped from our capitation payments this month. So that'll give an idea of how far behind the settlements are and when we might settle previous years. Page number 4, again, I think I've spoken to like provider services being higher. We've done some rate increases for residential and CLS. There's a full year worth of that in here, and those are highly utilized, and residential is a costly service as well. So that's why we're seeing an increase there as expected. Page 5, speak to, we continue to have Medicaid and Healthy Michigan surpluses. One thing Dave and I were speaking about earlier was the favorable, unfavorable on the revenue for Medicaid and Healthy Michigan. The reason for that is if you look down in the CCBHC section, we don't have a budget represented there. So if you were to move some of those dollars down to CCBHC, then this schedule would not have an unfavorable variance. The feeling here is that because of the way the CCBHC is structured, it makes sense to present it without a budget. But going into fiscal 24, I think we're going to try to, with a full year's utilization and experience under our belt, try to populate that. So I just wanted to highlight that in case anybody was wondering why we are not receiving less money than expected or anything like that. So it's more of a template issue. I'll note that CCBHC Medicaid, the surplus for both Medicaid and Healthy Michigan is about $8 million. Just to refresh the board's memory, that's local dollars that we should be able to keep at the end of the year that are not unrestricted, but the least restrictive funds that we have. So, page 6, we continue to run a CCBHC non-Medicaid deficit. That is because the supplemental funding sources that we have for that are not sufficient. And it'll effectively net with our state general fund surplus that's below that. I think we continue to push the state on some of those grant funds and our general fund allocation that's specific to non-Medicaid CCBHC to try to boost that up. But to this point, on the rate call today, actually, they I think they're adding 13 CCBHC sites, and that $5 million allocation has not increased for the whole state. So it's gonna be spread across more entities. So we'll see if the state adjusts that at this time. I don't expect that to be the case. Moving on to page 7 and 8. This is just the balance sheet and our income statement. There's nothing in here that I want to highlight at this time. I will go to page 9. I think I mentioned it last time where our state facilities is a negative number on there because of our recoupment of the My Health Link state inpatient issue that I mentioned earlier. So we continue to work that number down until we're back on the positive side with the state. I think that's all I have. If there's any other questions, Dave?
236?
236, yes. I think I'm planning on bringing a formal action next month, right?
The state sent out an email request. If a region has excess general fund, so it'd be on the CMH side. With the state's permission, you can contribute your excess to other people who have a deficit. The board did it once before. The timing was off to bring it as a formal action to the board. We might need a special board meeting or something, but we penciled in a tentative with board approval and some additional information that we might have up to $500,000 to put into the 236 transfer process. So we just wanted to bring it up tonight, get it on your radar, and we'll give you more detail as it becomes available to us.
Yeah, and I'll just,
Ryan?
sorry, Ryan, go ahead.
Hey, Ken, nice to see you. Quick question, and I'm just curious what you and Richard have seen in other communities about the, I'm sure it's perfectly okay and normal, but the debt, so to speak, that or the money that we're owed by the state, is that all going to be squared away, and is that common for it to be squared away for other CMHs?
The settlements?
Yes.
For the state?
Yes,
Everyone's kind of on the same schedule.
that's what I wanted to know.
Yeah.
We're just like everyone else.
And especially the last few years, there's been a lot of people that have lapses, or regions that have lapses, and some of them are large.
Okay.
So, yeah, we're on the same, I think they kind of do everyone at once, and oddly, maybe not oddly, but there is a portion of our FSR that pertains specifically to CCBHC.
Okay.
So 22 was the first year for that, and they did settle that almost right away. So I think they're trying to settle pieces more timely and catch up kind of the rest of it. So we are settled on our CCBHC fiscal 22 stuff already.
But we have the safety of the crowd, so to speak. We're not alone.
We are not alone.
Okay. Thank you.
Any other questions? Okay, thank you.
Thanks.
And then next, CEO report.
Tough act to follow, Ken. Thank you. You got my written report. The conflict-free access and planning, we continue to track it closely. Tracy and Tony have participated in some of the more recent meetings. We have pushed back at the association level and through the board resolution that you approved. Follow up to the rate setting meeting, just to let you know, we are working now with Wakely, which is an actuarial firm other than Milliman. And we're doing that through the Michigan Consortium for Healthcare Excellence. And I am your representative on that board. So they were in attendance at the meeting just before this one that ended just after 5 o'clock today. And they're helping us draft questions back about the whole rate setting process. The annual meeting for MCHE is coming up, and the Zoom link is in your packet. Ken touched on the $19 issue is still being open. The County updates, there was a 2-day kickoff about the central intake for the jail project. I was able to attend part of it the first day. Helen went on day 2. It's really, it'll be interesting. It's a great opportunity to provide more mental health services and substance use services to the inmates. That's outside of us currently, and then we'll be kind of plugging in on the jail diversion side ahead of time and on as they transition back into the community as well. But it's a really good partnership between us, the Office of the County Executive, the Board of Commissioners, the Community Corrections, the Sheriff's Department. So it's a good project that's going on. Our big news was Senator Debbie Stabenow's visit on August the 17th. We had little notice for that. Her team was very thankful, and Libby and our clinic staff over there at North really represented us well, and I can't thank them enough. We also had some people that had benefited by the integrated health efforts, and they were able to speak up directly to Senator Stabenow, and it was just overall a really good event. She's, a huge advocate for our services in general, but the CCBHC is was her brainchild to get it going, and it's just booming nationally, and it has really positive outcomes. So we're happy to host her. August 11th, Dana and I went out to Dutton Farms. I'm glad we kind of passed. Dana got there right on time. But again, as you remember, you approved a capacity building grant for Dutton Farms. It's one of those situations where I was able to spend some time, and you can just, we sat there and you watched the interactions and what was going on. The way the staff supported the individuals there and interacted with them was very positive. So we look forward to growing that. They're currently supporting, I think, 15 Macomb County residents. And some of those families had been having to pay out of pocket before we were finalized that contract. So again, thank you to the board for that. Kind of heads up for this one, Night Owl Support Systems. I say at this point in my career, it takes a lot to impress me. I sit through a lot of conferences and presentations. Night Owl Support Systems is a remote support. They have remote support professionals, or RSPs. They downplay the technology, but it is kind of has a foundation of technology, no video, but there's sensors, again, in somebody's living situation, and it helps offset those the hours where an actual person might not have to be there. Very person-centered. They turn down a number of referrals, and it's least restrictive, and they recognize completely that this is something new. It'll be a slow start. People have to get used to it and get comfortable with it. But we'll be having follow-up conversations. They're based out of Wisconsin. They started in Wisconsin, so they would be partnering up or working in conjunction with a local staffing provider or some number of those. In case there is an issue identified, then they would be able to get there in person. So he gave examples, real-life examples of people that they support. The funny one, they have a gentleman who has no technology. He has a telephone. And they said he's very independent. He makes his lunch every night, and he gets up in the morning and he goes to work on his own, and it's great. The problem is he has a roommate who gets up in the middle of the night and goes into the refrigerator, opens his lunchbox and eats his lunch, and then closes the lunchbox back. So this gentleman was going to work and then not having lunch. So they simply call him every morning and just go, "Hi, check your lunchbox." And that's all the support he needs. They also have the medication dispensers. So you can preload them, and it'll signal and go off, and then they can call and remind people and check, did you take your medications? They gave the example of a sensor on a bed in case somebody was having seizures, and it could be set to go off at certain limits. They install smoke detectors in each of those homes or apartments, living situations, that's tied to their system. The backup and redundancies, they answered all of those questions, so they don't go offline ever. And they don't use Wi-Fi, so if the power goes out, it's all through cell cards in all of the devices. It was impressive. Ryan?
Question, Dave. You mentioned that they have monitoring, but I think you said there's no video.
Right. They avoided
How
video.
What is this technology?
The smoke detectors, they have the medication dispensers. They have buttons of varying sizes and locations where somebody could ask for help.
How do they know the roommate is eating the lunch?
They call the gentleman in the morning and just have him check his lunchbox before he goes to work.
But how do they know the fridge is open?
They don't. They just call him in the morning to have him check his.
To figure it out. Okay,
It's not that.
All right.
I was thinking there has to be a way to get a lunchbox that's more secure, but.
Okay.
Yeah. But like I said, so with our staffing issues and with the focus on least restrictive environments and stuff, this is, again, when we look at our continuum, we do have some people this might benefit.
Yeah, that's what I was gonna ask, is like, would some of the families that receive like respite, that may have a higher functioning
Yeah.
person, like, if I decided to just up and leave my son overnight, I would be able to utilize this service for him at times?
Yeah. You
I'm
have to
done.
have the arrangements ahead of time
Right.
and things, yes.
I'm leaving now. No, that's what I want to know, because I do know so many that they can't really be down, they need that little nudge just to remind them.
Right.
You know, and I mean, you can set Alexas and alarms and all this, but I mean, just to keep track, like for independence,
Right.
I think this is wonderful.
Yeah, I've talked to families for years, and their concerns are real about what if.
Oh, yeah.
What
there's always a
if this
ifs.
happens? What if there's a fire? What if, and we need staff there 24/7 just in case.
And, yeah.
Well, nobody can, there's not enough money in the state to give everybody 24-hour one-on-one attention and staff.
I love it.
So yeah, in that continuum, this is kind of a really timely intervention. They're focusing intentionally on Michigan because our Medicaid waivers are flexible. It's a Medicaid-covered service. It falls under personal emergency response, which covers the hardware as a Medicaid-covered service and the monthly monitoring of that. So again, we'll be following up, and I'll keep you posted. Through the association, the CCBHC technical assistance, I included lots of detail there from Alan Bolter at the association. They're asking for the demonstration sites to work with the National Council consultant. So it was $5,000. They've already sent the invoice over, and we're participating in that. Since Christine is here, I attended my first statewide PIHP utilization management group. So I'm the PIHP CEO liaison to that group, and Christine was kind of, they rotate who's going to host it, and Christine was hosting it for my first meeting. Great group of people. Lots of interesting questions, trying to manage all of these Medicaid changes and the codes and how to track and report on all of these things. And so kudos to Christine for representing us so well at that meeting. Supported decision-making. I have also given our support. There's information there. It's alternatives to guardianship, which I've been in favor of for a very long time. Guardianship can be overused, and it takes rights away from the individual. There are alternatives, but we really need to help spread the word throughout the community, you know, that medical professionals and everybody else would accept that somebody has a different decision maker, an alternative decision maker. A lot of them go, I want to see your guardianship papers, and they're not as accepting of these alternatives. So there's a new initiative coming out for supported decision makers. I included that. The ongoing issues are the drop-in center for veterans. They were the core group of veterans for that project. We're at our North Clinic for Senator Stabenow's visit, and we're able to look at opening that up now because of the CCBHC funding. So that was a good connection. I wanted to highlight Tema, our new Chief Quality Officer. If you have not met her, you will. We got her from the Northern Michigan Regional Entity, so she comes to us with PIHP quality and compliance experience, and we're very happy to have her as part of our leadership team now. Let's see, residential tiered rates we're working on. So happy to answer any other questions about my report. Again, we have lots going on, so this kind of helps me keep things centered and stuff too. So questions at any time, you know, when you get it or in between, you all know how to reach me. Thank you.
Any questions for Dave?
Nick, you said you were going to give me hard questions.
Nothing, Nick? Thank you. Moving on to item 12, other possible agenda items. We have Christine Brothers that's going to give us a presentation on the managed care operations, the MCO. Welcome.
Good evening. My name is Christine Brothers. I am the director of our Managed Care Operations Department, and I'm just going to give you sort of a brief introduction of kind of who we are and what we do. Many of you probably have heard bits and pieces or have familiarity with us, but just kind of a broad oversight of kind of what we do. So we're a rather large department administratively. Under myself, we have one administrator who's a new addition to our team. She's hitting the ground running, and we're very happy to have her, Jen. I have 4 clinical supervisors, Jerry, Lisa, Kelly, and Sarah. I couldn't say enough how wonderful of a group this leadership team is that I have under me. Very capable, very committed, very intelligent people. They do a great job running our department. Underneath our supervisors, we have currently 45 bachelor's and master's level clinicians that are organized primarily into 3 teams focusing on different aspects of the work that we do. We have our hospital team, our call center team, and our team, and I'll get into in a minute kind of what those different teams do. So underneath the supervisors, they kind of jointly supervise, currently, like I said, 45 bachelor's and master's level clinicians. We also have 2 psychiatrists and then 3 clerical staff. So we're a pretty large department as far as our administration goes. We do a lot of different things, quite a variety of things. They're organized sort of into 8 different functioning sort of areas that sort of loosely organize all of the tasks. So the graphic there that shows you sort of all those different 8 areas, I'm going to go into detail here in a minute on each one. So I won't list them all now, but we'll start off with our utilization management, which is a huge part of what we do and really touches on one of the different function areas in different ways. But our utilization management team, they focus on really just ensuring that the people we serve get the medically necessary services in the amount, scope, and duration that's appropriate for their needs. That group of staff process on average around 3,000 authorization requests a month from all of our different providers for a variety of different services for the mental health, for substance use, and for the IDD population. So it's a very high volume of requests coming at them on a monthly basis. They are reviewing all of that information. They are working with the providers to try and get anything that's missing. working with generally to the providers. They don't usually have too much contact with the public, but it's really meant to try and get the services in place that would be needed for the people that we serve. And at times when we do have to give an adverse benefit determination, they ensure that there's a timely notification to the public that explains to them kind of what's going on and what their appeal rights are and how they can access those. Tied in very closely with that is our next area, which is sort of level of care determinations. So it's not just looking at the services and the documentation and whether or not they would be authorized for that, but the level of care determinations is to ensure that individuals are getting treatment in the most appropriate level of care for their need, in the least restrictive environment that can meet their needs, so that they can move towards independence and be as independent as possible. So we review requests that come from the individuals and their families or from their treating providers, or at times in our review of their record, we might note that maybe we would recommend a change in that level of care. So it comes from a variety of ways, but just to look at that they're getting the right services in the right level of care. We are available to the providers on a regular basis. They talk to us more informally. If they're not sure what way to go, what might be the right level of care or not, they'll call us and we'll talk them through sort of like little mini case consultations of what's going on, and maybe there's a service they're not familiar with and that kind of thing. So just helping people ensure that people are getting what they need in the right way. A large part of our department is the next area is our call center. So we do operate the Access Call Center for Macomb County CMH. So we're assisting the public with getting access to our services. Clients, the guardians, they call in when they're looking to get linked into services, either as brand new to us or maybe they've been out of treatment and trying to get back into treatment. So we do brief telephonic screenings to kind of help figure out where the best entry point is, and we get them linked to those intake appointments with the providers. That team fields on average of 1,600 to 1,700 calls a month, and in the last year, their highest month was 1,900 calls of people looking to get access into services and get linked to things. So it's a high need, and they do a great job at trying to help them figure out, you know, where they need to go and get them linked to that service. Our next area would be what we call our hospital team. They really work on the crisis continuum. They work on people that are in crisis and trying to ensure that they get the medically necessary services in, as always, the least restrictive level of care that can assist them. So they're looking at things all the way from state hospitals to the local community inpatient, but then also to some of our diversion options such as crisis stabilization, partial hospital, or crisis residential. So trying to stabilize that crisis and whenever possible, not go the inpatient route, to keep them in the least restrictive setting whenever they can. So that team actively works on the pre-screening and the continued stay reviews for those levels of care. They also work closely with the hospitals, but more so even with our own psychiatrists, reviewing the record, working with the primary providers, trying to develop good discharge plans, what we can do after that crisis is stabilized, what services would they need to be linked to for that. Our next area, focus area is County of Financial Responsibility, everybody's favorite, COFR. So we are responsible for a lot of those COFR determinations, looking at that the people presenting for treatment, that they are the financial responsibility of Macomb County CMH, and ensuring that they're getting authorized through the correct PIHP for whatever their medically necessary services are. A lot of times that's sort of looking at them as they're presenting for services, but we also monitor the ongoing authorization of services for clients that either are our responsibility but living in another county, and ensuring that we get the correct documentation and the correct authorization for their services, or interacting with the PIHPs that may have people living in our county but that they're paying for their services and making sure that we're getting those authorizations. So we're responsible for that area. Also in our department, we have the probate court liaisons. So they interact closely with the probate court on anybody that's on an AOT, so an assisted outpatient treatment order. They file all the paperwork for that. But more importantly, they monitor the clients that are on those orders. They work with the providers to make sure that they know about the order, that they know what services are supposed to be received, what the medically necessary services are. If there comes a time that they need to do a modification, and what that means is maybe the person's not being compliant with treatment, so they do have to be brought back into a hospital setting for an evaluation. They will file the paperwork with the court for that modification. They will work with the local police departments if they have to do a pickup order to have the person brought in, so that we can try and keep people in treatment and getting those medically necessary services and keep them stable. We also, most of the appeals and grievance process does not fall within our department, but what we do is the hospital appeals. So the first and second level hospital appeals, those all come through my department. Our psychiatrists do the first level. We work with the chief medical officer for her to do the second level, but and then for us to get the proper and timely responses back out to the hospitals. And then our final area that we have highlighted here, we call it technical assistance, but what that really is us working with the providers so that they understand all the options out there, the ways to get services, what documentation is needed to try and keep them as abreast of all of the rules and understanding the rules as possible so that they can get the most effective treatment to the people that we serve. So, for example, I'm going out to meet with all of the case managers at one of our primary providers later this week to sit down with them and just answer all their questions for a few hours. You know, what do you need to have for this service or that service so that they can best serve the people that they're working directly with. You know, another example of that, one of my supervisors, in conjunction with a couple of our departments, has been going to all the different emergency rooms and helping educate the staff there on all of the different diversion options and the options that are out there so that when somebody presents in crisis, they know what's available other than just inpatient. Especially focusing on services for kids, because we all know that kids are best served staying within the family unit, but still stabilizing the crisis. So in a lot of different ways like that, we work with the providers to help them understand what they need to best serve the people of Macomb County. So that's sort of a brief introduction to what we do. Did anyone have any questions?
No questions? Thank you.
All right, well, thank you for your time.
Thank you.
Thank you.
Very nice, thank you.
Any other agenda items from the board?
Can I just make a comment?
Yeah.
Donna?
Yeah, I just wanted to let see if I can get this to work. I just wanted to let everybody know I attended the wedding at Crossroads Clubhouse. Unfortunately, it was the same date and time as the Debbie Stabenow visit, but Bruce officiated it. And I found out that he actually went to classes for a long time to be able to perform that wedding. And it was standing room only. And they donated all of their wedding money back to Crossroads, which I thought was just unbelievable. It was just a tearjerker. I don't think there was anyone there that had a dry eye. It was just so emotional. And all of the members of Crossroads attended. It was absolutely beautiful. They had a beautiful layout of food, and I'm telling you, it was just one of the most wonderful things I've attended all year. So I just wanted to report back about, I was just so happy I had gone because it was just such a wonderful love story to be able to watch and, witness. So I just wanted to let you all know. I was so glad I went.
Thank you for sharing that. Lori?
Yeah, and I just wanted everyone to know, I did on August 1st attend the conflict-free access and planning workshop at 9 a.m. It was run wonderfully. I was in a room with the other 16 other participants. They divided us all up. They asked 4 questions. The first 3 I can remember, the last one I can't. But it was like, what's working, what's not working? What do you need improvement on? What do you see out there? And it was an hour, 10-minute discussion that it was phenomenal because they listened and were taking notes and everything. So I did that. And also on September 9th, I have to read it off my email. I am attending a Zoom for behavioral health, 915C, a HCBS waiver renewal feedback and confirmation such. That's more like just answers and questions. the providers have, and I'm really interested in that, so,
Want to translate that?
I don't know what it is. I need the original,
HCBS is Home and Community-Based Services.
services, right.
We have, Michigan has a Medicaid waiver, the 1915 C waiver.
Right.
Is specific to the children's waiver, the serious emotional disturbance waiver, and the habilitation support waiver, or the three Cs. So that's what the listening session is about.
Right.
I know we get into our Medicaid speak a lot here, but yes.
No,
So it's very,
Yeah,
yes,
I was
it's good
invited
that
to
you
that,
attend.
and so I'm attending that, because it is something that's awesome. My son has, and so many of my friends' kids have, and I just thought, all right, I'm checking this out to see what everyone has to say, good or bad. And if I have to give my input, I will.
How shocking.
Thank you. Let us know how that goes.
Yeah.
Dave?
I just failed to acknowledge that Lori and Mark were with us for Senator Stabenow's visit.
It was
So
wonderful.
thank you so much.
What an elegant, classy lady. Okay.
Any other items? Okay. So we're going to move on to 13, hearing of the public. Anybody from the public that would like to speak?
Not public.
Oh, boy, right. I just want to remind everybody, please, if you can make it to the Health and Wellness Fair that we're having September 23rd, we appreciate to have you, okay? Thank you.
I'm working that one.
Anybody else from the public that would like to address the board? Please come up and state your name.
My name is Jackie Cantanella, and I'm from Richmond, and it was perfect because I'm one of those C waivers. We just aged out of a children's waiver, and we had to transition into the adult system. And we normally would go to VDPS, but VDPS could not take us because they are understaffed right now. They're hiring more help. So we had to select an outside provider, which we select Hope Network. So we started that process April 6th. The children's waiver case manager submitted all the requested services, OT, CLS, respite. We were getting overnight health and safety because my son likes to elope. In addition to explaining to them that we wanted to seek out the habilitative supports waiver. So that started in April. We had a Zoom meeting that they attended with us. He just aged out 7/31. And during the month of July, I had 4 in-person meetings with Hope Network, and nothing was done. The self-determination packet didn't get handed in until 7/31, so we waited until 8/11 to have services reinstated again. The HAB waiver still hasn't been done because I haven't signed anything. And we've now aged out of the system. We get a preferential slot aging out of a children's waiver. Have I lost that? No one knows. Yeah, I'm assuming. It's kind of my lack of, and it's okay. I'm afraid another family, like we've done this since 2012. We've had children's waiver since 2012. If I don't know an answer, I can at least go to someone and find an answer normally. And my children's waiver case managers tried. There was Zoom meetings with supervisors in the middle of the month. They didn't know, they finally said, we don't know what to do with HAB waiver. So Rihanna, the supervisor for the children's waiver, went to network operations, got all the information and emailed them, like, this is what you need to do. And nothing has still been done. So now I'm gonna have to hopefully transfer, does VDPS have openings yet? I'm gonna have to transfer to another agency, but in order to do that, I have to have the agency I have no faith in transfer me to new services.
I broke the rules. We're not supposed to.
I know you did. I've been here once before, and I know we don't usually communicate.
But after the meeting closes, I will be here.
Okay.
Thank you for
I know,
bringing
so all
this
of your
forward.
information was super helpful, and I would have referred them to you. They probably have talked to you already. So that would be great. Thank you, everyone.
Thank you for
Have a
bringing
nice
that
evening.
forward, and we will reach out and we will be in touch.
Thank you.
Thank you. Anybody else from the public? Last call. Anybody else? Okay. Moving on to item 14, adjournment. We have
Support.
all in favor?
Aye.
All opposed? Meeting adjourned.